Well, hello everyone, and welcome to this panel. We're going to be talking about what is really kind of an impending catastrophe for the Medicaid program in the United States. I'm actually shocked by how little this is being discussed in the news. I can't think of any sort of catastrophic healthcare event that has happened in. I think even people who lost their health insurance during the pandemic because they lost their jobs didn't impact as many people as this is going to. Estimated possibly 15 million people being dropped off of the Medicaid insurance rolls just in the coming year. So we really wanted to focus on this. It's going to be such an important issue for us this coming year. We're going to have to fight back against this. So we brought an incredible panel of folks to talk about what's going on with Medicaid, to explain it for us so we can understand it, and also to talk about how can we organize to fight back to make sure that this doesn't actually happen. So I'm going to start off by introducing our panelists. Thank you all for being here. Really appreciate it. Imorobi Josie is the national field organizer at the Center for Popular Democracy, and he's also kind of leading the charge on the Medicaid organizing for CPD. So thanks so much for being here. Then next, we have Dr. Sanjeev Sriram, also known as Dr. America, who is a health justice correspondent for We Act Radio. He kind of, writes about the connections between health policy, inequity, and social determinants of health. Dr. Sriram completed his medical degree at UCLA. He's also a chief resident there in the Department of Pediatrics. Then back in 2009, he didn't have enough education already, so he had to earn his master's in public health after completing the Commonwealth Fund Mongan Fellowship in Minority Health Policy at the Harvard School of Public Health, just down the street from me here in Boston. And right now he practices general pediatrics in Maryland. And last but not at all least, Rebecca Wood lived all over Virginia before she relocated, very wisely, I might say, to Massachusetts here. Rebecca has worked with many organizations and offices on Capitol Hill. Her healthcare work includes rallies, protests, press conferences, and conventions. Most notably, she told her and her daughter Charlie's story at the introduction of Senator Sanders' Medicare for All Act of 2017, and she also testified before the House Ways and Means Committee hearing on pathways to universal coverage back in 2019. They didn't want to call it the Medicare for All hearing, so they decided pathways to universal coverage. But Rebecca also regularly volunteers for Remote Area Medical, which, if you don't know about them, do amazing work. They provide access to healthcare for underserved communities. And she's also active in the push for universal school meals and has had some actually amazing victories around that recently. So let's start off this topic. Sanjeev, I want to start by asking you, before we even talk about what's happening to Medicaid now, can you just tell us about the Medicaid program in general and, who are these 84 million residents who are covered by Medicaid right now?
Yeah, so really glad to be part of the panel and joining comrades, from across the country. And yeah, so Medicaid is one of the most common forms of insurance in the United States, but it's probably one of the least talked about because it's not that well understood. 1 in 5 people in the country have Medicaid. I mean, it's hugely common. And as you were saying, there's 84 million of us who have this insurance. 37 million of those are children. And so this is the largest insurer of children across the country. At the other end of the life spectrum, Medicaid is doing so much of the heavy lifting for long-term care. And it really does wonders for the people who have it, as far as really alleviating what would be devastating poverty. Medicaid is a huge anti-poverty program. For people who are not in Medicaid, one of the reasons why you should really care about the program is that there's not a single hospital in the country that doesn't depend on some way or the other about Medicaid dollars. Like, Medicaid makes every single hospital in this country function in some way or the other. There are some hospitals that obviously need it a whole lot more than others, but there is not a single hospital in this country that could, do without Medicaid. So, the hospital near you, even if you are not on Medicaid, is most definitely benefiting from Medicaid support and funding, and wouldn't be able to do a lot of what it does without it.
Mhm.
So, Medicaid is really that super, it's a superpower that has stayed kind of
Mhm,
secret
mhm.
in a lot of different parts of the country, but we really need to blow that secret wide open and help this program
Yeah,
out.
and one question I had, follow-up question for you is, we talk a lot about Medicare, probably because it's kind of the sort of the model for Medicare for all movement, but Medicare increasingly under attack by privatization. Do we see the same thing with Medicaid, even though it's a life-saving program? Are there attempts to privatize it, sort of take a chunk out of those
Oh
dollars
yeah.
for-profit corporations?
Oh, absolutely. There are managed care organizations. So you have insurance companies in every state that are clamoring
Mhm.
for Medicaid contracts. And this is really not a red state or blue state issue. You've got a lot of states that claim to be super progressive and, have elected a lot of progressive people to state legislatures, but their insurance company lobbyists are in those
Mhm.
state capitals, like having their claws and clutches on the Medicaid
Mhm.
program, and a lot of them would struggle, if they did not have a Medicaid contract in that state. And
Right.
so Medicaid, and that's like for good and ill. I mean, there are some states that have done really well with regulating insurance companies that partner up with Medicaid, and other states that have
Mhm.
not. One of the challenges that we're going to face in this, in this struggle is that we've got 50 shades of Medicaid, and it's really complicated because the problems that Medicaid faces in one state, you just move across state lines, and it's a whole different can of
Right, and
problems.
there's
I'm
nothing
gonna
sexy about 50 Shades of Medicaid.
I just wanted to add on with the privatization of Medicaid. I've had experiences of that in 2 states.
Mm,
In Virginia, Charlie had what is called a Medicaid waiver, which is how disabled kids get their
mm, mhm,
services through the state. And when she first got on it, it wasn't privatized; it was just Medicaid. And after she was on it a couple of years, Virginia went private with it,
mm,
and there was a drastic change in that, when it wasn't privatized, it was just about getting her care, and when it became privatized, the push was to get her off of it any way possible,
mhm,
and it was
mhm,
a nightmare. It was really intrusive. Like, the insurance company would send a nurse unannounced to our house to evaluate her, and at the time, my
mm.
ex-husband was working from home, and we said, "This is really not a good time. Can you," and they say, "Well, if you deny this visit, then you risk losing your insurance." And yeah, it was really living under the thumb there. And
Right.
then,
Yeah.
moving to Massachusetts, again, Charlie ended up on Medicaid, and it's privatized here as well.
Mhm,
And
mhm.
I've run into the problem of very narrow networks with the privatized
Right.
plans.
Yep.
So if she needs to see a gastroenterologist with a pressing matter, a lot of times I have to apply for her to switch networks, and then we'll get that taken care of, and then she'll need a developmental pediatrician, and again, we'll have to apply to switch networks in
Mhm.
order to be able to see one. So it's really been problematic in ways that people who haven't experienced it more than they realize.
Yeah.
Yeah.
Sounds, yeah.
And I mean, and that problem is further compounded by this problem of having about 12 states, I believe it is, that have not expanded Medicaid under the Affordable Care Act. And then even if
Right.
states have expanded Medicaid under the Affordable Care Act, they might not have upgraded the program to everything that it's supposed to do to help
Mm,
people keep the coverage, which I think is something we're going to talk about
mhm.
more over the course of this panel. But yeah, when I said 50 Shades of Medicaid, I mean it really is that, like, you cannot like reduce this down to a blue state, red state matter. Like, there are plenty of blue states that as Becca just mentioned, that ought to do better and are not. And so I'm glad that we're having this panel, because this is something that every single state in this country really needs to be alert to. And there's a lot of people that we can help when by taking on this fight and doing right with it.
Yeah, I think that's a great point, and we call it the Medicare for all movement, but Medicaid for all would be just as good. I mean, both programs, we need to fight back privatization. We need to make them work. But now that we've talked a little bit about what the Medicaid program does, who it serves, even though it's under attack by privatizers, it's just life-saving, extraordinarily important for those 1 in 5 Americans who are on it. So Imarabi, can you sort of bring us up to speed about what happened to Medicaid, during the pandemic, and what is it that's being changed now that's putting so many people at risk of being kicked off?
Yeah, absolutely. And first of all, thank you so much, Benjamin, for having me here. It is an honor to be amongst really great people who are focusing on the healthcare healthcare community, and I'm excited to be able to have this conversation to really, really dive in deep into what's happening and how we can really impact the changes that are happening. Yeah, so Medicaid during the pandemic, the public health emergency was enacted, and folks and recipients of Medicaid were able to have what we call continuous coverage. And what what continuous coverage included is just the ability to not have to go through the constant eligibility process that can be very cumbersome and costly.
Right.
Also, with that, states were receiving extra money, extra funding to be able to provide extra services and to insure people who wouldn't normally have the chance to be insured by Medicaid. Um, and now that that is ending, because the Biden administration was trying to thwart an effort by the colleagues on the other side of the aisle to kind of stop it unexpectedly. So now we have what we are calling the unwinding. And that just means all of the states are going to be going through a re-eligibility process for their Medicaid recipients. That's going to span over the next year. And, like we said in the beginning of the call, we're probably going to see a lot of people lose their coverage. Of course, some of those folks are folks that have aged out of the process, children that have aged out of the process, and folks who no longer qualify. But the issue with that is, some of those qualifications that people are losing out Medicaid to are income gaps, or they moved to a new address and they weren't able to fill out the paperwork properly,
Right.
or something as simple as like they got a phone call from the office and missed it, or they called into the office and after 3 hours of waiting to talk to someone, they had to go back to work. So there's a lot of like really ridiculous things happening that we understand that it's not because people are no longer eligible, but just like this whole process, this whole undertaking of re-eligibility is something that states are not built to handle. So some folks are going to lose their coverage even though they still qualify.
Yeah, I was shocked to hear exactly how many people were likely to lose their Medicaid coverage, even though they are still eligible. I think I think they said something like 6 million, over 6 million people.
Yeah, about 7 million.
Yeah. So of those 15 million who are likely to lose it, 7 million are actually going to be eligible. And is this just how it was even like before COVID, before this continuous enrollment process, that people were constantly being churned out of Medicaid or turned down just because of bureaucracy, basically, that they can't jump through the hoops? Or
unfortunately, like disruptions in treatments for like chronic conditions is a part of the cost of Medicaid churn. So like you think about this, say it's actually costing Medicaid more money to do this because of the disruptions, because of the increased administrative costs for states and county administrators, and because of the increased administrative burden for the beneficiaries. This is costing Medicaid actually a lot of money. And even though that these people still qualify, or they might have not qualified for a month, it still is a process that is being blown into a proportion that is just absurd, in my opinion. Nobody should be losing coverage because they make $30 more than the required income gap. So.
Right. And Sanjeev, you working in pediatrics, what was your experience before COVID as opposed to during COVID with Medicaid patients and their ability to keep continuous care throughout their treatment? And I mean, both preventive, but also if you lose coverage in the middle of something important, then
I mean, so, the churn that we've been talking about, right? It should never have existed in the first place, right? I mean, just like as was pointed out, I mean, like, you got like a small raise at work. I mean, it's like, chances are it's still not a living wage. Like things like doing common sense stuff, like moving away from an abusive partner, like, I mean, having a small change in your address, changes such as like, yes, like, one of the people in your household is no longer a child, but they still are very much a young adult who is struggling to find a place of their own and get on their feet. Like those were all really dumb requirements and like, eligibility
Right.
rules for being in Medicaid, and they were always the rules that got patients off, the Medicaid roles. And it didn't matter, like, this is like, again, one of those things where like blue state, red state doesn't matter, right? Because stupid rules are stupid rules. It doesn't really matter, like,
Right.
I mean, who's running them. And for the little bit of time that we had during the pandemic, being able to like, just not deal with that, right? To be able to kind of see things through, where you're building a good continuous like, relationship with the family. You're able to kind of like use like one known network of like therapists and specialists when you need them. A lot of those things are just like, I don't consider that
Right.
luxury as a pediatrician. To me, that is like common sense
Right.
healthcare. And we're going to disrupt that if we don't, I mean, put pressure on these states to fix things that are very much within their power to fix.
Right. And they also had payments to families with children at the same time, which probably also had quite an impact on their ability to access the care they need. So, and then they
Right.
both went away at the same time. Rebecca, did you? Because a lot of us have heard your story and Charlie's story, but we might not realize that Charlie has also kind of relied on Medicaid. Is one of those millions of kids who gets Medicaid. Do you want to tell us about that? And
Yeah. Well, first I wanted to comment on what Sanjeev was saying, that well, actually it builds upon when he was saying hospitals rely on it, but what a lot of people also don't realize is that schools often rely on Medicaid, because if kids getting special ed services get OT or speech, a lot of times those can be billed to Medicaid. So schools will lose funding as well. But as far as Charlie's story goes, I was I was gonna say recently divorced, but it's been 5 years now. Um, and part of the custody agreement was that her dad would be responsible for her healthcare coverage. So the first year or two, this worked for us because he got his coverage through his employer and he just added her to his policy. However, when he switched employers and relied on the marketplace for healthcare, he was not allowed to insure her because he lived in Virginia and was using the Virginia ACA marketplace while she resides in Massachusetts.
Right.
So she relies on Medicaid coverage because I got my coverage through Medicare from SSDI. And so there is no good way other than Medicaid to insure her. And so this year when they were talking about eligibility requirements, I was cringing. Fortunately, we just made it under the bar this year, so she gets another year of coverage. But every year I'm worried about what the heck I'm going to do for coverage for her if she's found ineligible. And
Right.
that, as you pointed out when we were talking before this, that also impacts the choices I make as far as employment goes and decisions like that, and whether, how to increase my income, and almost kind of traps us into poverty.
Right. Right. Yeah, that's extraordinary. I mean, no parent should have to like try to limit their income so their child can have health care, and that's the situation Medicaid kind of puts us into, unfortunately. And also, you were talking about how Medicaid, although it's partly federally funded, it's also partly state funded. So each state, as Sanjeev was saying, has their own kind of Medicaid program, but they also administer them separately, which creates these. It's really hard to have these cross-state kind of family plans. And one thing we've talked about at Healthcare Now is how Medicaid was created in the 1960s when medical facilities were still segregated in the South, and the reason that Medicare was a federal program and Medicaid was a a state-run program was actually to enable states that had segregation to continue segregating, especially physicians' offices and long-term care facilities. And those took much longer to desegregate than hospitals did, because in part of this, so we're basically living with, the legacy of structural racism in the United States creates a lot of these problems that we now have in Medicaid today. Sort of along those lines, Imorobi, I wanted to ask you a little bit, who is being impacted most by this change? Is this just going to impact communities across the board, or are there particular communities that are going to be being hit hardest?
I mean, you said it just now. We already know clearly the communities are going to be affected. It's going to be Black and Brown communities and low-income communities who are going to be hit hard. And we're going to see that a lot of those folks are going to lose coverage. And because of that, a lot of families are going to suffer. And this is not something that is unknown or new to this process. We've seen this before. Like, there's millions of children, millions of families who are have been constantly put through the runner on this. But it's funny that you mentioned how the system was historically and systemically created to be to really affect people of certain cultural backgrounds, for lack of a better choice of words at the moment. But it's continuing to be that way, and I feel like it's something that we have to address in the long-term things and in the long-term solutions that we're coming up with. And I'm happy to talk about some of those things too, on how we feel like we can change.
Yeah, I would love to have that conversation. I think we'll talk a little bit more about organizing and taking action, and maybe we can also talk about what can we do beyond just defending, the Medicaid we've had in the last few years.
Yeah.
Well,
this is a racial justice issue, right? I mean, I think that one of the things that, because people who come to Healthcare Now's, annual conference, I know a lot of you are, diehard believers in Medicare for all. I am too. I'm, all about that single payer life. That's my passion. That's my fire, right? The thing is that this fight is one where we get to assert our values about healthcare being a human right, healthcare being a racial justice fight. That when it comes to, this house is on fire. I just don't think this is the right time to be getting into your building materials really suck. And it's listen, I get it, right? Medicaid has got a very ugly history to it. There are a lot of things that have been done in a lot of different states that have brought us to this place. And, and a lot of that is wrong. I think that, but now is a great opportunity to assert some values that, let people know that, hey, we're not going to just abandon people to a very preventable situation. That this is our nation is majority people of color when you look at the child population, and Medicaid is their largest insurer. We can't just be abandoning people to these very human problems, which, by the way, are very are very insidious and have an ugly way of sneaking their way back into things when we have a Medicare for all program. So addressing and confronting these problems now means that we're going to be much more alert to them and stronger to fight them if they decide to make a sequel when we build Medicare for all.
Rebecca, you were going to say something earlier too.
Yeah, I was just going to say, when we were talking about cultural and race and so forth, I think it's important that the language barriers are also addressed, because that's one of the reasons people are kicked off of Medicaid is simply because of language barriers. And Medicaid offices or social services don't have enough translators or sufficient translators to help people through the paperwork.
And I'm so glad that you brought that up, because 100% I see that in pediatrics all the time. Parents are immigrants and they might not qualify for certain kinds of programs. They might not be on Medicaid, but their children are U.S. citizens and are depending on exactly the phone calls that, you know, Becca's talking about. And, you know, when there's somebody who is not linguistically competent, you know, calling and, you know, like, I mean, you know, getting on this family's case, you know, even if it is like, you know, something benevolent, like they're trying to help the family keep coverage, right? Like if you're not connecting, you know, with that family in a culturally competent manner, then you know it's these kids that are going to suffer for it, and they didn't have any say in it. You know, I mean, like this is like they're caught up in our stupid fights, and so I'm really glad you brought up that point, Becca, because it really does pose a major threat at blowing minority health disparities wide open.
Right.
And also, it's I saw it used against us in organizing efforts by using the language differences between us and not being able to speak to one another. So I definitely think that is a pressing issue, both for, you know, the Medicaid discussion, but also a bigger issue with organizing overall.
Yeah, so that's clearly a structural barrier issue, and you know, when we were doing a little bit of research on this project, we came up. There was a local Montana newspaper that published the story of Ian Ward, who after a car accident was suffering some significant physical and mental health challenges, including sort of loss of short-term memory. And he was really struggling to navigate the renewal process of Medicaid just because of memory loss. He lacks a trusted individual in his life to kind of give him his care as well as to help him through the process. And his physical disabilities also kind of limit, you know, how much help and resources he can access on his own. So you can just see, I mean, how is it reasonable for us? I mean, this is a healthcare program. It's supposed to be for folks like in situations like this. How is it reasonable that we're putting up all these bureaucratic barriers to staying in the program that are much harder for people who have those very health issues we're trying to help? Makes it impossible to navigate. So
Additionally, I'd like to point out that being poor is exhausting and traumatic. And it is so hard to navigate bureaucracy when you are simply struggling to survive. And it's just frustrating that these barriers exist for people who don't have the time, the energy, the education, maybe the language skills, or any number of issues to keep them from getting health care.
Yeah, and I was asking facetiously the question, why would we do this? And Roby put in the chat section, money. Do you want to expand on that?
It's always about the money.
I've been thinking about this process for a long time, and yeah, you know, it costs the states money to do it. You know, it costs the states money to do that, and unfortunately, like, when you think about how the for-profits, like, okay, I'm going to go down a path, but like, just bear with me here. The for-profit healthcare system does not work. It does not work because it is focusing on profits rather than focusing on the best kind of care to provide, the most affordable kind of care to provide. It doesn't care about those things, and it does not care about the people that it's helping. So that leads to this whole issue of like, okay, so now the states have to use an exorbitant amount of money just to provide simple services that don't actually need to necessarily cost that much. And so states are avoiding it, right? So states are avoiding it because, one, they don't want to take on these costs, and two, because, you know, there's this whole idea now that, you know, providing healthcare and these like services is kind of like a it's like taboo. Like, it's like, you know, it's become like a political issue where, you know, if we're providing these services, then we're, you know, we're democratic, but if we take away these services and make cuts to these, then we're, you know, Republican. Sorry to make this not bipartisan, but this is just the way it is, you know. And you know, I hope to move towards a place in where we could, you know, reach Medicare for all. I just like that's just it. That's just it. You know, that's the end goal. You know. So yeah.
And that's where I feel like our Medicare for all values really inform this fight, right? Because I mean, like, shame on us that we keep splitting people into deserving and undeserving, that we
Oh my
keep having
gosh,
to like
nasty.
question people about like how much do you earn, who lives in your house, where do you live. Like instead, with a single payer system, it's as simple as like, what's your name, what's your date of birth, can we get some contact info to follow up with you, like, I mean, and that's it. Like, your humanity is your eligibility, and that's all you should need. So to me,
Exactly.
like, that value is actually what's informing this fight, because we never should be putting people in a situation of like, can you prove to us that you're actually financially needy? It's like, like I need to prove you anything. I mean, like, it's healthcare. Like, it's like cancer didn't decide that I was like financially stable enough to have that. Like,
Right.
employers don't like double check my W-2 like before
I
they
don't get
like
it.
attack. Like, it's like, I mean, like, so these, like, it's just so laughably stupid to like ask people all of these innate little things, build bureaucracy that is whose sole function is splitting people into deserving, undeserving, and undeserving for the dumbest things. You didn't pick up the phone, you moved your house and we sent it to your old address. Like, all of this is so unnecessary, so painfully stupid. And to me, like, that is exactly the energy that we need to bring to this fight, and that is actually, those are Medicare for All values, right? That we want our humanity to be the only eligibility criteria in healthcare. And I think that, like, the more that we bring that to the fight, the more that we're going to be responding to a very urgent crisis, but also planting ourselves in a very important moral high ground for the fights to come.
Yeah, absolutely. And Sanjeev, you've been kind of making the case for the Medicare for All movement to care about this Medicaid fight. And I think if we're looking in the mirror and being honest, a lot of the Medicare for All movement shows up as soon as Medicare is attacked, and is like, oh, this is part of our program. We have to protect Medicare from privatization. This is kind of part of building the system that we want. But when it comes to Medicaid, I don't think there's the same history, the same urgency of engagement. And I think we have to look in the mirror about, is that because of not valuing the constituents, the communities that are covered by Medicaid the same? I mean, maybe not intentionally, but maybe unintentionally. And I think it's just urgently important that this fight for Medicaid becomes part of the Medicare for All movement, and that we embrace it the same way that we do the fights around Medicare.
Right.
So,
I mean, because who is the all in Medicare for All, right? Like,
right.
who? I mean, like, like, that to me is like kind of where this fight, like, has like its moral underpinning, is like, who is all? Like, I mean, like, and to me, I think that what radicalized me to join, the single payer movement was, and I mean, Becca was there for it. I mean, like, it's those 2017, like, I mean, rallies and acts of civil disobedience led by, people with disabilities. It was people with disabilities, like, I mean, like, shouting at the top of their lungs, getting pulled out of wheelchairs, demanding just basic dignity for healthcare. And they were really fighting to protect Medicaid from getting cut. That, I mean, to me, like, it radicalized me in a way that made me realize that, like, this is actually what should be binding us, that none of us should be having our worth questioned when it comes to something as critically human a value as healthcare. And I mean, I really hope that, like, a lot of our Medicare for All friends, I mean, don't be a standby, like, don't be like, kind of like like just sitting in the stands for this one. Like, get in the field on this, because like, it really does matter.
Yeah, I wish they. Oh, go ahead.
Oh,
Go ahead,
I was just, I think a lot of people understand that one day they're going to end up on Medicare. I don't think they realize that they are just one catastrophe away from ending up on Medicaid.
Right.
And they need to fight for that. Like, they realize they're going to end up on it, or may end up on it, just like they will Medicare. I never thought I'd have a kid on Medicaid until I did.
Yeah, great point.
Yeah, very true. Yeah, I was just simply going to say, I wish that this country cared about healthcare the way they cared about building up our military.
Right.
The amount of money, the trillions of dollars that they spend on warfare, I wish they took the same care to actually healing this country. And that's all I was going to say.
Maybe we need a war on disease and injury or something.
Wouldn't that be amazing if like the country just was like, you know what, we're going to fight, put all of our money in fighting cancer, fighting diseases, and focus in on preventative care for everybody. Like just to, that'd be amazing.
Yeah. I mean, just having a love fest for our own vulnerability, right? I mean, like to me, like that's one of the big takeaways from the pandemic that just never seemed to really happen, was that like, just how vulnerable you are like right now, not like in some future potential, thing, but like in the here and now, like, I mean, we own this bag of cells and it is crazy ass vulnerable and it's nobody's fault and it isn't anything to be ashamed of, and there's no such thing as like deserving or undeserving or worthy or unworthy, like it's you're just human. And I think like just embracing that vulnerability is such like an act of like solidarity and love that it can really inform what goes on with all of this, because to me, like that's what is so lacking in like in protecting Medicaid, is that this understanding that like yeah, you might not have a family member who is on it, right? I mean, you might not think of like your elders who are in like who are getting any kind of long-term care help, or if you've got a family member with disabilities, you might not be thinking about them in all of this. You might not be thinking about children. But like if you drive by a hospital, like at any point, like while you're doing your errands, if you're in the bus or on the train and see an ad for a hospital, that place is getting it depends on Medicaid. Like that place is part of and connected to this vulnerability, and we want it to be there for all of us. That it shouldn't be that like, oh, it's there for me because I can afford it. Like, no, it's there because like you're human, and that's as simple as it needs to be. And I think that like this is such an opportunity to assert those simple values that I think really would build our movement. That like if we can win this fight, like it would be so huge for a movement to bring in some to some people who understand and embrace that vulnerability, rather than kind of operate from like this intellectual elitism of like, oh well, Medicaid sucks because it has like this problem and that problem, and it has rotten building materials and da, 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 and it's sort of like, okay, but like what good it does like in the here and now, like for the millions of people in it. Like, can we embrace that part and connect on that part, because we really need that right now.
Yeah. And with 1 in 5 Americans on Medicaid, probably we all do know someone on Medicaid.
Yeah.
There's so much stigma around it. People don't always speak as publicly about it as Medicare. So I wanted to close by talking a little bit about how do we fight back? How do we organize, minimally to prevent this catastrophe of 15 million people losing health insurance over the next 12 months. But also looking further down the road, longer term. Roby, do you want to talk a little bit about what Center for Popular Democracy is doing, what your role is there?
Yeah, absolutely. So we have like different levels of solutions. Obviously, the ultimate one being Medicare for all. Like that is like this be all solution. Like if we did that, then we understand that none of these other issues are going to matter anymore. Obviously, that is a longer fight and a longer road. So what do we do right now? So some of the things that we're asking are like states should make sure that no one loses care during the unwinding, and use all of the different funding that's coming in, like the IRA funds to expand care. We're calling on governors to ensure all states unwinding is as fair and as equitable as possible. We need to protect our communities and our healthcare, so we're calling on states to specifically transfer as many people as possible to other sources of health insurance if they are deemed ineligible for Medicaid, like the state marketplaces under the Affordable Care Act or CHIP, to comply with all federal CMS requirements for the unwinding process. Make a good faith effort to obtain and update contact info for all beneficiaries. It's just something simple that you should do to just make sure if you're not getting in contact with somebody, if you can't reach somebody, don't just kick them off. You know what I'm saying? Give them the benefit of the doubt and really try to reach them. seek other sources of funding to maintain and expand Medicaid. Like, it's just like, you know what, the government has all of these different funding that's coming in. Why don't you look for them? We're asking for states that are non-expansive to expand. You know, this is money that's coming from, part of the money is coming from the government, part of the money is coming from people that are already using these services. There's some of the fundings that I'm talking about, the American Rescue Plan Act, the Inflation Reduction Act, and, lawsuits and settlements coming from all of the opioid crisis stuff. Fund community navigators through trusted community organizations to ensure that the frontline organizations are able to support communities who will be mostly directed, and that just mainly means Black and brown and low income folks. And, expand care. We really understand that right now we're coming up on a really huge moment with the budget talks. As you all know, we've hit the debt ceiling. And so when folks are having conversations about how are we going to, move forward funding in this country, they're making talks about cutting healthcare, cutting Medicaid, cutting Social Security, but nobody is ever saying anything about making cuts to the military. Stop, the illegal occupations of other countries. Nobody's mentioning those things. So these are some of the conversations that we're going to be having. We're actually having a lobby day of visit with some of our Medicaid cohort, which will be like 7 different organizations right now, heading over to DC on April 25th. And we're going to be bringing up some of these conversations and talking about this with our legislators. We're going to be putting on some actions, and we're going to be, making some noise out in DC. So hopefully you all can join us out there. We welcome everybody and everyone to be out there to help us make some noise. So those are just some of the frontline things. There's also some other things like legislatively passing legislation to like standardize Medicaid between the states. Why are all the states having like different forms of Medicaid? There is like legislation to like have certain services be provided, but we need to standardize that. Like you shouldn't go to West Virginia and have access to what I'm saying, to the disabled children subsidies, and then have to move to a different state and lose all of that because the other state doesn't care. So that's just a short list of some of the things that we could do right now.
Yeah, and speaking of West Virginia, I mean, we almost got, I think, kind of an expansion of Medicaid in the Build Back Better bill that was blocked by Senator Manchin of West Virginia and Kristen Sinema, and I think there was a provision in that to kind of get around the states that have not expanded Medicaid under the Affordable Care Act, and to actually kind of offer a federal program for folks who would normally be eligible if they had expanded the Medicaid under the Affordable Care Act. So thank you very much, Senator Manchin. Now this mess is like way worse.
Yeah.
I can speak from experience that he did not enjoy us being on kayaks outside of his houseboat.
That's one of the things that I really think that a lot of us on the left can remind our friends in the center is that, listen, if the Affordable Care Act is this important to you, then use all of it. I mean, one of the part of the Affordable Care Act, it's 13 years old now, so by now we should be using all of it. One of the things that it says is that, states should be using better renewal processes, right? It should be using common sense procedures. Like if you've got, family and patients who are on SNAP, food stamps, chances are they're eligible for Medicaid, and vice versa. People should, patients shouldn't be hungry. Hungry people shouldn't be without health care. You should really be able to connect these dots without bothering the people involved in them. That this data should be existing, and it should just require that you connect dots to make sure people don't go hungry, people don't go without health care. Right. Only 26 states have adopted the 12-month continuous eligibility for children. So that means that if you're a child who gets signed up for Medicaid and CHIP, right, your renewal should not come up for at least 12 months. And only 26 states have said, yeah, that's a good idea. Only 37 states have said that a woman postpartum, like after she gives birth, will have 12 months of continuous Medicaid. More states should be doing that. And these are not far left ideas at all. Like, this is the kind of stuff that would actually protect millions of people for the long, like, you know, at least in the short term, so that we can bring them to the long-term goal of Medicare for all, like we've been talking about. And these are all things that are within, you know, the boundaries of the ACA. This is like in the centrist wheelhouse. We're not asking them to put a toe outside to the left. Like, really just do what is in your lane, and you would actually be saving a lot more people. Instead, it's a lot of thoughts and prayers talk that we got to like rattle them out of, you know?
Right, right. Yeah, the failure to cover children is just like, I mean, I don't know what set of values that's consistent with, left or right, you know, but it really, they ring hollow when people are okay with kind of letting millions and millions of children lose their health insurance or not have it in the first place. I mean, really just kind of stunning. But
I mean, I think like this is also like that really, you know, ugly, this is that really ugly part of racism just kind of rearing its head again, right? I mean, like,
as long as it's poor
majority,
kids,
right?
yeah.
It's like the majority of children in this country are people of color, and the majority, and the overwhelming majority of children in Medicaid are children of color. And you know, the long-standing, like, either you've got pity or you've got like a really ugly, you know, let them eat cake kind of attitude that goes on in these state houses when it comes to their healthcare, their food, their housing. And I think that this is a really important moment for us to confront that, you know, regardless of the color of the state, regardless of how, you know, progressive you think your, you know, your state legislature is. You know, now is the time to remind them that, like, we owe it to these kids to be so much better than this.
Yeah.
And that you would actually save a ton of money. That, like, it's actually a dumb waste of money for Medicaid to go through this renewal process every year. Like, do some basic common sense. And this, again, as I was saying, it's in the centrist lane. This is so not like, you know, we are not drifting left or anything. This is like exactly where, like, you know, that comfort zone of theirs is supposed to be. And I think it's a great time for us to challenge them on it, because, you know, like we were told that, oh, this is the pragmatic way forward, and, you know, we got to be realistic. I'm like, there ain't nothing realistic about millions of kids and millions of people losing out on Medicaid. Absolutely not.
Yeah. Well, I want to wrap this panel up. Thank you so much, all of. I just want to thank Rebecca, Sanjeev, and Mirobi. Thank you all so much for participating, sharing your kind of knowledge about this. And this is just, you know, the start. I mean, this unwinding, which is really terribly sanitized language, just started about a week or two ago. So we're going to be starting to see the real life effects, you know, anytime now, and it's just going to get worse and worse as the months go on. So, Roby, could you just tell us real quick if folks want to get involved with that DC lobbying day, or get involved with, you know, organizing in any particular state, how they would reach CPD?
Yeah, email me directly. Actually, I could drop my email in the chat here.
Okay.
Josey at populardemocracy.org. Email me directly, and we can get you involved. And if you all are really interested, we can help with travel. See if we can get you there.
Okay, I'll put that up on the screen. Rebecca, Sanjeev, any organizations or work you want to plug that's kind of relevant to this before we wrap up?
Social Security Works and CPD are good friends, partners. You know, I mean, we're in this together. Healthcare Now has got great stuff going on. So yeah, definitely follow Social Security Works on all the social media channels. If you're not, they're going to definitely have great content to follow too.
Right.
I just want to jump in on that and say, yeah, I endorse CPD and getting involved in all of their mischief.
Good trouble.
It's definitely been very formative in my work, and I wouldn't be able to have done a lot of the work that I've done without them. And so even if you're just a little bit interested in checking them out and their action out, go ahead and go for it. it'll be amazing.
Yeah, thanks so much. Healthcare Now is also going to be getting more involved with this. We'll be launching some actions as well. So anyone who's on our email list, healthcare-now.org, we'll let you know, give you some opportunities to get involved. But I think like so many things during the pandemic, we got like a little taste of what it might feel like to have some like health security, some of us in certain circumstances. And then it's being ripped away from us. Like a lot of these very temporarily social supports that we got for the last 3 years. So that's obviously we're facing a huge threat here, but it's also a big organizing opportunity because people now kind of know what it could be like. Yeah. So we're gonna carry this on, take this from talking about the problem to fixing the problem. Thanks so much again, and I hope everyone else enjoys the other panels in the conference. Bye, y'all.
Thank you. Bye, y'all. Thank you so much for having me.